Well, good morning, everyone. Thank you so much for being here. It's really a delight to see so many people I haven't seen for a while, and so that's especially exciting to have you here. So thank you for joining us at the Community Health Endowment. Before we get started, I want to just mention the special meaning of today's event. In addition to getting the chance to talk with Kim, it's important to remember for a moment that Lincoln General Hospital sold in 1997, and the sale of that hospital led to two community-changing events. One of them, of course, was the creation of Bryan Health's second campus, Bryan West, but there was also the creation of the Community Health Endowment as a result of that. And so we know that Bryan's second campus, along with its campus at Bryan East, has impacted our community mightily. It has obviously provided quality care. It's created huge economic impact, job creation, charity care, so many things. But also it's important to remember that the results of that sale, the $37 million that the city received for selling Lincoln General Hospital, has resulted in the last 20 years of a return back to the community of about $33 million, as well as we still have assets of about $63 million for future generation. And so I think it's important to say that we have a common bond between our organizations, and so that gives this conversation today some special meaning. But I am excited and I'm grateful to have the opportunity to sit down and have a conversation with Kim Russel, because she has led Bryan for 12 of those last 20 years since the creation of CHE. Her resume, of course, is impressive. She's asked me to keep it brief, and I will do that, but I want you to know that prior to joining Bryan Health, she was the president and CEO of Mary Greeley Medical Center in Ames, Iowa. She served as a COO at the University of Kansas Hospital and held a variety of administrative positions at Iowa Methodist Medical Center. She's a graduate of both Purdue University and Washington University. Among her many positions, she's a fellow at the American College of Healthcare Executives, an active member of the board of directors of both the Lincoln Chamber of Commerce and the Nebraska Chamber of Commerce, as well as the Lincoln Partnership for Economic Development, Foundation for Educational Services, Dialysis Center, Home Dialysis of Lincoln, and the Federal Reserve Bank of Kansas City, the Omaha branch. But of course, her most important position is as the former chair and the current trustee of the Community Health Endowment. And so we can't forget to mention that. She has led Bryan's team during the implementation of the Affordable Care Act, the new electronic health record system, multiple expansion projects on both campuses, as well as providing, of course, state-of-the-art care to thousands of patients. So please join me in welcoming Kim to our conversation today. Thank you. So we're going to jump right in.
All right.
And we're going to ask some questions, and then at the end we're going to talk about these 5 lessons learned to wrap up today's conversation. But first, we know that what brought you to Lincoln was the exceptional reputation of Bryan Health. But when you arrived in Lincoln and you began to learn about the community, what things did you notice about the community of Lincoln?
Well, I really did not know much about Lincoln, Nebraska at all. Like many people, had only seen it from the interstate on the way from Iowa, where I was living, to Colorado. And really my research was all about Bryan Health, and of course I learned what a wonderful organization that Bryan was. But when when I first started touring as part of the interview process, touring Lincoln, the very first thing I remember being struck by is at that point in time, a bond issue had been passed to expand and improve a number of the Lincoln public school buildings. And as an outsider, that meant so much to me to see the support from the community for the Lincoln Public Schools. And I was also told how the enrollment was increasing at LPS. And that also to me was just a big indicator of what was going on here at Lincoln. So that's one of the first things I remember is the LPS story at the time, which of course has continued. And then the other thing that I remember hearing about was the Vision 2015 group. And I've always been a huge believer in public-private business partnerships. and the group was starting to gel in terms of getting leadership behind a number of the wonderful things that have happened in Lincoln. Obviously, the arena is maybe the most visible example of that. That was just barely in the works, starting to be talked about when I came into the community. So all those things were just such a positive story about what was happening at Lincoln and in Lincoln, and really made me want to be part of it all.
That's awesome. Well, I know that you spent a lot of your first years with the Endowment, and ever since then, also spending time out in the nonprofit community by going on lots of site visits, visiting with lots of nonprofits. And I'm going a little bit, we haven't talked about this, but one of the things I have to mention about Kim is how engaged you got in wanting to know all of the community, not just the business community, not just the healthcare community, but you really wanted to become knowledgeable about nonprofits and all of those services that are going on that a lot of us don't always think about.
Well, absolutely. And when you think about providing healthcare services to the community, it takes all of those segments, if you will, including the nonprofits and the human services organizations. And for me, it was just a real treat, actually, to be involved with Community Health Endowment and to have this kind of door opening to be able to learn about all of these excellent services that we have here in Lincoln. And again, I was just so impressed at the depth and the breadth of services that we offer to our community. You don't often see that in cities of our size, as well as the collaboration underneath all of that. And of course, CHE has been a big part of that collaborative story. So for me, it was just a wonderful opportunity, and I'm very grateful to have had that as a way to learn about this community and the care and services that are out there for the people that we all jointly take care of.
That's great. Well, switching gears for just a second, we know that one of the things that's happened in the last 12 years and even before that in healthcare has been technology, and you've been right in the midst of so much of that. So can you tell us about the biggest things that have changed since your tenure at Bryan, but maybe even what you anticipate might be happening in the future?
Well, absolutely. I think when I think about American healthcare and what really sets healthcare apart in this country, it's technology. And we only have to look as far as the academic medical centers, for example, in Omaha, that are actively conducting research that eventually ends up being used by our clinicians to help our patients. Not only in fields like cardiology or critical care or trauma, but even in some of the, even in primary care, for example, there's been a huge impact of technology on those services. So I think we've only just begun to see the way technology is going to be impacting not only medical care and medical services, but the way that we deliver services as well. When I first got into this field, obviously that was before the day of the smartphone and the internet and all of that, and just think about the ways those devices are being employed to help educate us, keep track of all of our information, make sure that there's seamless communication between all of the caregivers. All of those things have added and impacted the delivery of healthcare services, which I think is very positive. And again, looking ahead, same thing. I mean, there's such active R&D going on in all of the major biomedical and other companies, as well as academic medical centers throughout the country. I think that the future is very bright for advanced technology. I find it incredibly exciting, the fact that we have the type of cancer treatments that we have now that years ago did not even exist, so to speak. So I think we're going to continue to see just more and more of those developments, and it's one of the reasons I still find healthcare and medicine just such an exciting field to be in.
Yeah, I mean, it's amazing to think of what's happened just in the last decade, and I can't even imagine what's going to happen. And it's probably one of the reasons why our view of hospitals have changed, our view of healthcare has changed. It's not the only reason, but it certainly has to be one of them. And so when you think about how we view hospitals today, how do you think that's changed in your tenure? How do you think the way that communities look to hospitals?
Well, I would have to say I think that citizens are looking to hospitals for, I guess, more and more, not just on the medical side of things, but on the social support side of things. When there is a community disaster, for example, people generally pour into the local hospital because we often, have made special arrangements to have power and food and water and all those other kinds of things. So hospitals really are an incredible community resource for even more than medical care. On the other hand, I do have to say I often find fault with the way hospitals are portrayed in TV shows or movies or something like that, and particularly the hospital administrator is usually portrayed as the evil person, who all they are concerned about is cost and budget, and nothing could be further from the truth. So, discount what you see in your movies or your Netflix feed.
Okay. Good advice for all of us. Well, I know we have some current and former healthcare providers in the audience, and I'm sure people listening at home. And so when you think about the training, how people are trained different, you have a College of Health Sciences.
We do.
You obviously have many, many health providers on your staff. So how do you see the way they've been trained, and how has that shifted over time?
Well, I'm glad that you bring this up because the training of the education and training of the next generation of healthcare professionals is just so incredibly vitally important to the overall quality of our healthcare system, and the training remains state of the art, I think, as it always has been. It's just that the state of the art has advanced. Again, much more technology included right from the get-go in the curriculum, et cetera. However, I think what the challenge remains, and this is one of the reasons why I'm so, of course, very proud of the Bryan College of Health Sciences, the challenge is to train our students not only on the latest and greatest, technology and, medical thinking, but to couple that with the practical skills, the hands-on skills, and the personalized ability to be able to relate to each and every patient as an individual. And I think that's the real art, if you will, of the whole educational experience. Medical schools across the country are revamping curricula. In fact, they're even revamping admission criteria to try to perhaps better mirror or better match the general population. There's some interesting experiments going on at different medical schools across the country on that. But again, kind of no substitute for every graduate, deeply knowing and understanding, their field, their research, but in the field, but actually being able to practice it in, again, that very personalized kind of human-to-human way.
Well, and it's looking for a more probably well-rounded individual, a person that has obviously the ability and the academic prowess to be able to go through a very rigorous program, but someone who can also work with technology and someone who can engage with people. And so you're
Right.
looking for this, perhaps a different kind of person than we were looking for
A different
long
skill
ago.
set. And the other thing that has evolved over time is, healthcare has always been a team sport, but I would say it's even like team with a capital T. And by team, I mean multiple disciplines of different specialists all coming together to provide care for a patient. And in the, I would say, old way of education, sometimes folks didn't really even encounter that team until they were actually in practice. And now what the idea is to expose students in their education and training into being part of a team, so that you have nursing and pharmacy and laboratory people and physicians. Maybe you're all training together, maybe you're running a case simulation together, but just a lot more focus on the whole team aspect of healthcare, which I believe is to the benefit of patients.
Yeah. Well, one of the interesting things, and a lot of people, we've had conversations about this through the years with a lot of folks, but the idea of a locally owned hospital and what that means to a community. You know, I mean, Bryan is a locally owned hospital, and it was one of the things, I mean, it has someone who was through and who lived the experience of selling Lincoln General Hospital, which was a difficult experience for the community at the time. But we talked to hundreds and hundreds and hundreds of people about what they wanted. One of the things that was clear without question was they wanted to maintain a locally owned hospital. And in fact, it was one of the reasons why perhaps the sale, why everything seemed to line up so beautifully. So can you talk about why you think a locally owned hospital is important?
Well, I'd love to. That's one of my favorite subjects.
Oh, good.
What a coincidence. Well, first of all, I'm really kind of relieved that I missed that part in Lincoln history, because people have told me what a contentious time that is, and it's because people feel such personal connection with their local hospitals, and they depend upon them so much. But so I'm not at all unhappy that I missed all of that. And I had the opportunity to meet Mike Johans a while ago, who was the mayor of Lincoln at the time, and he told me that in his entire political career, the sale of Lincoln General was the most difficult thing that he ever dealt with. And considering some of the national and international things he had on his plate, I thought that was quite a statement from him.
It was a challenging time, there's no question.
So I'm not at all surprised to hear that the citizens in general were placed a very high priority on kind of maintaining local governance and local control. And of course, selfishly, I think the City of Lincoln made an excellent decision in kind of partnering up with, at the time, Bryan Memorial. But really, what the difference is when I use the term local, what that means is that the leadership for the health system and also the board members are all local Lincoln or close by Lincoln folks. So we all live, work, go to church, grocery shop, whatever in the area, and I think that builds even tighter connections and tighter understandings of what the needs might be, what changes might be. It helps you understand the context, and it means that this is our number one priority when we're making decisions about healthcare. And personally, that's just been my belief my whole career. I just have a real belief in local healthcare. I've always worked for organizations that were community-based. And that was one of the things that I did probably the most research on before I accepted the position at Bryan. It was very important to me to understand the commitment of the board. And as I began to get to know the board members and did my own due diligence, that was very clear. And just one kind of example of that, I believe it's that the provision of behavioral health services, which are focused and concentrated on the Bryan West campus, the former Lincoln General campus, to me that is just such an important responsibility of a health system like Bryan's. And to see that those services had been in place basically forever at Lincoln General, and that when the merger happened, those services continued, and when many hospitals across the country have stopped providing mental health services. And so just to see that was continuing and to see that commitment, that to me was, walking the talk, if you will, of of local hospital and local governance. So it's just my personal belief of the ideal way to provide and deliver health care. And so I've just been very honored to be part of all of that legacy, and it's very fitting, this whole story, that was such an important principle in that very major decision that the City of Lincoln made back in the late 90s.
Well, and as someone who was here during that period and was kind of in the midst of all of that, and for those of you who remember the contentious kind of environment, I mean, it took leaders to take us through that, Mike Johans being one of them, but I think also we remained very committed to the idea of what the community was telling us is what we believe should happen, because it was a community hospital. The endowment is a community asset, and so who wouldn't we listen to except the community? And so the idea that the mental health services are still there, as was committed to in the early days, and just that focus on remaining local, I think is something that we take for granted, but that we should that we should really recognize was just an excellent result of all of this.
Right.
So,
Agreed.
well, I read the other day that a nation's health can be judged by 3 things: how long people live, how well infants and mothers do in their first year of life, and whether people have adequate health insurance. So while Lincoln does really well, I mean, we exceed the average in each one of those things, it's fair to say that these social determinants are really becoming a factor in poor health. And it's something that we have to address as a community, but hospitals certainly and health systems play a role in that. So what role do you think Bryan Health or the Bryan Health system can play in the social determinants piece? It's a big question nowadays.
It is an excellent question, and I think one worthy of our time. First of all, so many of those things are areas where Community Health Endowment is very active in its grants to try to support various community initiatives along those ways. And so I think that's a wonderful resource that we have. But you're absolutely right. I would say when I first entered into this field, like decades ago, those of us who worked in hospitals, honestly, all we really focused on is once the patient was in front of us, took excellent care of them, and once they went home, they just were no longer on our radar screen, or they weren't our responsibility any longer. That was kind of the thinking at the time. Well, that thinking has really evolved to a much more maybe holistic view of the patient and of our responsibilities. And so that's why you see hospitals all over the country, including at Bryan and here in Lincoln, getting involved in things like making sure patients have transportation to their medical appointments, making sure that people have adequate food supply, trying to help people access prescription drugs after they leave the hospital, trying to make sure that perhaps if there's an unstable family situation and there's young children in the family, trying to intervene or take action as appropriate in situations like that. I mean, and so those of us who are in healthcare, I think, have really had to widen our view beyond just what's in our building. Maybe the most recent example of that is a partnership between Bryan Medical Center and the Food Bank of Lincoln. We are now screening every patient that stays with us overnight. We're screening them for food insecurity by asking a series of questions. And patients that screen positive, that they do have challenges with food insecurity, we do provide backpacks full of food when they leave the hospital to kind of get them through for several days before they're able to be hooked up with a more permanent food source. So just things like that. I also think the focus on social determinants of health is bringing hospitals in general kind of in closer working relationship with their local public health departments as well as with other human services agencies. There's a lot of creative work going on around the country in this regard, and again, we're so fortunate that CHE has the ability to fund some of these creative ideas as well.
Well, and I think it's a good time to talk about one project that Bryan has been such a big part of, but also in combination with a nonprofit, which is the Lincoln Literacy and Bryan relationship. And one thing we know is that people are coming to Lincoln as refugees and immigrants. They come with health experience. They come with a passion for providing health care, but often they can't practice here because of the language barrier. And so Lincoln Literacy has created a preparatory class to enable people to gain the language skills they need in order to practice at re-entering or to be able to re-enter the healthcare system as a certified nurse assistant.
Right.
And so that, I think, is a really a wonderful example of how nonprofits are raising up the language skills of refugees and immigrants who have a passion for healthcare, and then hand them off to Bryan, of course working in tandem to allow them to be trained as a CNA. And I know that program right now has put I don't know, 15 or 20 CNAs back out in the community and on a career path, which you also offer is a career path for these folks that then they can continue reintegrating back into the health career that they hope to have here. Right. So that's a great example of you guys, of Bryan working closely with a nonprofit.
That is a great example. And Lincoln Literacy, obviously an outstanding organization here in Lincoln. And we're, again, of course, grateful for CHE funding that made that program happen that Lori was just describing. Even prior to that program, however, Bryan had a partnership with Lincoln Literacy to provide English language learner classes for a subset group of our employees. And we had those classes offered right at the hospital so that there was no transportation issues or anything like that. And that's kind of an ongoing a program that we have, because absolutely being able to obviously speak and communicate with coworkers and with patients is kind of, job one to entree into the healthcare fields. And so, yes, we're so fortunate to have nonprofits like Lincoln Literacy to partner with.
Yeah. If we all tried to do it on our own, we would be in trouble. So I'm going to ask you a really big question, and that is, if you had all the resources that you needed, both human and financial, but you could only address one community health issue, what would it be?
Well, I'm really glad you gave me this question ahead of time.
I didn't want to, but
I mean, I have been thinking about it, and since I only have one.
Only one.
What I came up with is obesity, because it's such a problem in our, not only locally, obviously nationally, and it's, again, foundational to so many other medical problems in terms of contributing to diabetes and all of that. And CHE, of course, has devoted a lot of its resources to various obesity-related grants, especially focusing on the kid side of things. And there have been some good wins, I would say, along those lines, but a lot of work left to do. So as I kind of look at there's many that I could have selected, I guess.
Yeah, I didn't know what your answer was.
But yeah, but obesity to me, I think, is maybe the biggest umbrella one, and so that's why I selected that one.
It's a question for all of us to think about. I mean, I think obviously that's not what we have to do, but it helps us really hone down where we think the issue is that maybe has the most ripple effect out onto other issues.
Right.
Well, now I want you to talk about your 5 lessons learned. And I don't know if we picked the number 5 for no reason. And so if there's 6, that's okay. Good. There can't be 4 though. There has to be at least 5. So I know folks are, based on your long history, starting all the way back, as maybe you all read, her first job was, your first job was in a hospital, right? I mean, but I know your most significant first job was as the Dairy Queen.
Dairy Queen,
yes,
yeah,
so
absolutely.
Starting all the way back then, moving forward, if you could just sum up somehow those big lessons learned that we can kind of carry on with here.
Well, I'm going to color outside the lines and give you 6.
Oh, good. Okay.
All right. Okay. No, in no particular order other than the last one. Okay. First one, technology. I mean, when I look back on when I started in this field compared to now, I mean, the technology is just mind-blowing. It's just incredible, the changes that have happened. So technology is ever-changing and will be ever-changing, and for the most part, I think it's positive. I've watched people really resist technology at various phases in my career, and lesson learned, embrace it, don't fight it. That's number 1.
Okay, good.
My next one is been kind of a mantra of mine for a while, and I think that sometimes people don't understand what a major driver of local economies that all of the healthcare providers are. When Bryan Health used to be the largest private sector employer in Lincoln-Lancaster County. I think we're number 2 now because Nelnet exceeded our number of employees. But we have over 5,000 employees at Bryan. So think about the economic impact of that. Many of our smaller towns in Nebraska, the largest employer is either the long-term care facility or the hospital, or sometimes those are one and the same. So as we think about the economics for our state going forward, I think the healthcare sector should be regarded as such an important economic driver. And of course, the jobs that we provide through our hospitals and other healthcare providers are high quality jobs, well-paid jobs, good benefits, et cetera. So I really believe that healthcare should be welcomed, throughout our state as a very positive economic driver. Next one, people use that phrase, all politics is local. So I would change that to all healthcare is local, and we talked about that earlier. I'm just a true believer, inside and outside, about the importance of locally provided, locally driven healthcare. So local healthcare. Next one, in case you're counting, this is number 4. This is just kind of I guess you could almost say an anecdotal observation of mine. I don't know that there's a lot of great research to back this up, but one of the pleasures of a job like mine is you do get contact with patients and families throughout the day, throughout the week, and I really enjoy that. And my observation is that patients who actively participate in their own care, or by educating themselves about whatever their medical situation might be, that those patients just seem to do better than patients who don't participate actively in their own care. And kind of along with that is, and this can be very difficult to do, but people who are able to maintain some sort of a positive attitude or hold on to something positive as they're going through a medical challenge, again, my observation is they just seem to do better. So kind of hopefully an argument to be engaged in your own
Very good.
in your own health. Number 5, and I kind of talked about this a little bit in relationship to Bryan's commitment to behavioral health services, but the behavioral health needs in our country are just ever increasing, and I don't see that declining, the behavioral health needs declining. I don't see them going away by any means. And my goodness, there's examples in the media every day of, frankly, the failures of what I would say the failures of our behavioral health systems in our country. And, as evidence of that, aside from the bad stuff in the media, as evidence, look at the funding. We continue to cut funding across our country, across our state for behavioral health services in the face of this increasing demand. And I think it's related to, there's still stigma related to individuals who have behavioral health diagnoses or whatever. I think there's still a societal stigma there. So I see behavioral health needs as kind of a flashing red light or something, or flashing light for need locally, regionally, nationally. I wish that I had some magic secret sauce solution to all of that. Okay, that was the 5th one.
Bonus. The bonus.
Number 6. The people who devote their lives to providing healthcare services for others, in my mind, they absolutely walk on water. We would not have the community that we have without those folks who are 24/7 through the worst of weather, through holidays. They are giving their all to take care of, of their neighbors and fellow citizens. And often people, of course, when you think of a hospital, you immediately think of our doctors and our nurses, but it is the entire team. Our environmental services folks who are front line against infection, all of the technologists, all of the behind the scenes people, our IT people who could be working in any sector of this economy. IT people can, and they choose to work in the medical side. I mean, we all owe, I believe, such a such a debt to those folks that when we lay our heads down on our pillow at night, they're working and making sure that they're there and ready should we need them. I just have the most tremendous respect for people that have devoted their lives to the healthcare professions, and
That's
I'm
awesome.
sure glad they're there because I know I'm going to be needing them at some point. But it's also one of the reasons that we feel so strongly at Bryan about our commitment for educating the next generation of healthcare professionals.
That's awesome.
So there's my 6.
Awesome, great. That was perfect. Well, I think that sums up kind of our conversation. I'm going to have a few closing remarks, but I want to make sure that you all have a chance to ask questions that you'd like to of Kim. And I think Marcia has a microphone, and if you just raise your hand, and she'll come to you. And Jane Raybould is the first question.
This is an easy one for Kim, but you spoke about obesity as being one of our greatest challenges. What do you think the role of Bryan Health should be? What do you think the role of community should be? And what do you think should be that own individual personal responsibility be?
Well, it's, all of the above. Starting frankly in the exam room and in the primary care office, I think that our physicians have sometimes more influence than they know when they are one-on-one with their patient and discussing some of those types of health issues. I think that's part of our role as healthcare providers to provide all of that education. I think being a role model ourselves is part of it. Jane, there's a city responsibility as well. Sidewalks. I mean, walking, I think, is like the most important thing out there. Not only for the obesity, but for people who are struggling with depression. Getting outside and walking whenever the weather possibly allows is just a great help for that. So walkability and parks and all of those things kind of all, I think, work together to help encourage more healthy eating. And in a sense, we're kind of fighting against society, if you will, our society that's based on cars and screens and sedentary work. I think that there's a role for all of us, I guess you could say, and CHE has certainly been working through its funding decisions to help support a lot of those ideas, I guess.
And one thing we would say as well is that focusing on obesity is incredibly important. We know that it shortens people's lifespans and that the next generation has very much the likelihood of living shorter lives than our current generation because of that. But we also have to focus on aerobic fitness. That's one thing that we have learned, that having an aerobically fit child will lead to better academic success, better job opportunities, and better health moving forward. And our mapping project, and you'll see some of it on the walls here, will tell us that aerobic fitness in our youth combined with obesity is a deadly mix. And we need to do something about it as a total community, as Kim said. Next question.
Hi, Kim.
Hi, CJ.
There's been a lot of talk about all the baby boomers that will be coming into the healthcare system, having a lot of need. How is Bryan Health preparing for this influx, and how is maybe the community at large preparing for this need?
That is a great question because the statistics really are quite something when you see the numbers of baby boomers who are becoming eligible for Medicare every day. I would have to say, specific to Bryan Health, and maybe I'll toss the rest of the question to Lori, but specific to Bryan Health, we are in almost constant planning mode for making sure that our services and our facilities are appropriate, have the appropriate capacity to be able to take care of that, of the increases in patients that we're expecting. So a lot of the facilities changes that you've seen happening at Bryan over the past years, and a lot that we have in the plans for the next 5 years, are because of our thinking of what's coming down the road, so to speak, with that cohort. So that is very much a big part of our planning, and time will tell, obviously. But I think most of us in healthcare are really anticipating what that big cohort is going to be needing in terms of its healthcare services. So yeah, absolutely, that's really on our radar screen, and I believe that we are and will be prepared for it at Bryan.
I think the other thing too is that we need to recognize that not every baby boomer is going to be alike. People are going to age very differently. I think we as a culture have to look at people, a community holistically. So instead of having senior centers here and youth centers here, we're going to need to create a culture shift that says we need to look at people from a multi-age, multicultural, multi-generational way. And so if we suddenly say there's this line we draw and all of these folks over here need to be treated alike, I think we're going to run into a big challenge with having enough services. But if we begin to say, how can we integrate generations? How can we begin to treat ourselves holistically as a population? I think we're going to be much better off. But that's going to challenge our thinking. We tend to think in silos. Young, we put youth in centers, we put seniors in centers, we put everybody in their own spot. And we're going to need to create a much more cross-generational set of services in order to move forward.
Well, the other thing I would add to that, the other thing that technology is really changing is what can be done in the home setting. And I think you're seeing more and more seniors remaining in their own homes for longer and longer, and a lot of innovation happening on that kind of home technology support side for people. So it's exciting.
It's a big question, though. Mm-hmm. Other questions?
Hello. This is a disclosure. This is really not a question. It's more of a statement, if that's all right.
Sure.
Okay, yeah. My name is Kurt Donaldson. I was on the Lincoln City Council at the time that we made this decision to sell Lincoln General, and I just want to take this opportunity for a minute or two or three to thank Kim Russel and the entire Bryan community for maintaining the commitments that Bryan made at that time 22 years ago, because they were not legally enforceable. I note that you wrote last year an op-ed piece, October 19th, the Lincoln Journal, and I clipped it out and I said, I'm going to get a nice letter written to her, and I see that time is about up. So I'll take this opportunity. Instead, in the op-ed piece, you noted some of those commitments were specifically to maintain trauma care, mental health services, substance abuse treatment, and charity care. And those were indeed very important to the City Council. It was the thing that I certainly spent the most time on. And at the time, we had the option to consider really three options. One was to reject the advice of the hospital administrator at Lincoln General and continue Lincoln General operating independently. The other was to affiliate with St. Elizabeth Hospital and CHI or Bryan. And it was a difficult decision, but very key to that was to say, well, who is local enough and has enough profitable services to support substance abuse and mental health? Because at the time, I worked very closely with Arlen Stromberg on this, and I asked him at one point for him to prepare me a list of all the money-losing specialties at Lincoln General. And he prepared me a list, and I never made a copy of it. He asked me not to share it with people at the time because he said it would be disturbing to the staff. But let me just say that substance abuse and mental health were on that list. And I can't imagine that they are profit centers at this day. And as you noted, Bryan is the only medical center in the state of Nebraska that offers inpatient and outpatient services for both mental health and substance abuse treatments. So I wouldn't want to see the numbers, but I appreciate the work. See if I had anything else on here. So anyway, I just want to recognize that my phone never rings on this issue, and I think it would if it hadn't worked. So I'm delighted.
Thank you for offering that. I really appreciate that, especially since you were on the council at the time. Thank you very much.
Can I say one other thing on the time? That is not generally known. As we sought to balance health facilities in Lincoln, there was a lot of concern about creating an entity that had 70% of the market. Going with St. Elizabeth would have balanced the market better. So we went to the lawyer for St. E's and did ask for conditions of the sale that they would like to see in, and there were a number of them that we could not do for antitrust purposes, but one of them was that Bryan at that time had a exclusivity agreement with Blue Cross Blue Shield. And as a part of the sale, we were able to delete that agreement so that St. Elizabeth was able to participate in Blue Cross and Blue Shield, and they very quickly became their largest insurance partner. So at the same time, we were able to assure the competitive position of St. E. So we worked very hard on this.
Like I said, I'm glad I missed all that, because that was very difficult work. You earned your salt on that one, didn't you? Thank you.
Other questions? No. Well, I just want to say on behalf of the community, all of the people here, all of the people across Lincoln who have worked with you and with Bryan, I'm glad that you stopped to take a look as you were going from Iowa to Colorado. You stopped to take a look and find out what Lincoln is about, and you've certainly left Lincoln. We will leave Lincoln better than you found it. I know you're not going anywhere. You're going to stay here. She told me when I asked her if she was moving, she said, no, I want to stay where there's the best health care in Lincoln, or where the best health care in the country.
Right,
and so that would make sense. But I know there is the lure of 2 grandchildren. One who is weeks old.
Weeks.
And so no worries about what Kim will be doing in her retirement. But it has been an absolute pleasure to talk with you today, to serve alongside you, to be mentored by you, and to have the opportunity to get to know you. And so thank you for sharing your experiences. Thank you for sharing your expertise with Lincoln. We're better off that because you were here.
Thank you,
so
Lori.
Thank you.
Thank you very
and
much.
And please
Appreciate
thank
it.
Kim for sharing her
Appreciate it.
story.
Thank you. Thanks, Lori.
And thank you all for being here, and enjoy the rest of your day. I will tell you that if you'd like to share this conversation with anyone, you go to the YouTube and look up LNKTV. You will find it there. And I will also ask you, we continue these conversations next year just like this. And if you have issues that you would like to us address and that you would like to learn more about, please let us know, and we would be happy to do that. Thank you, and have a great day, everyone.
Thanks, Lori.